Epilepsy is one of the commonest neurological disorders worldwide, and it is seen in all ages, all countries, and in all races. Infants, children, adult, and old people all are affected by epilepsy. The worldwide incidence is about 1%, and nearly 50 million people are suffering from epilepsy around the world. Males, females, they are equally affected. There is a biphasic distribution of epilepsy. The first peak is between infancy and 20 years of age, and subsequently it plateaus, and the second peak is above 60 years of age. Various myths and misconceptions about epilepsy exist. Epilepsy is derived from the Greek word which means to seize upon. And in the older times, epilepsy was considered as a disease, or the person is seized upon by the demons. And still today, epilepsy, the belief exists that the person suffering from epilepsy is being hunted by the witches, or demons, or evil forces. Classification of epilepsies. The epilepsy can be classified into two broad categories, that is the primary or idiopathic, and the second is symptomatic. But actually what we classify is the seizure simiology, not the epilepsy. The International League Against Epilepsy and International Bureau, they have classified seizure in various types. They have classified into generalized seizures and focal seizures or partial seizures. And there are special epileptic syndromes which can be classified like benign childhood epilepsy with centrotemporal spikes and occipital spikes. Now, when the patient presents with the epilepsy, the presentation can be different. The worst presentation that we see on the roads or in hospitals or anywhere outside is that the patient suddenly develops jerky movements involving the upper limbs as well as lower limbs. So this is more what we call as the generalized tonic-clonic seizures. But not necessarily all the seizures are generalized tonic-clonic. It can start in the face with just facial twitching, or it can involve the upper limb starting from the fingers and spreading further, involving the upper limb, the face, and the lower limb, and becoming secondly generalized. Or it can start from the legs, from the feet, and subsequently it progresses to involve the lower limb and involve the upper limb and becomes generalized. So basically the seizures can be generalized seizures, or it can be focal seizures, or focal seizure with secondary generalization. Now, investigations. The most important investigation in cases of epilepsy, to diagnose a case of epilepsy, the first and the most important thing is an EEG. And with the investigations further being modified, we have the video EEG. Video EEG as well as the EEG, they will define the existence of an abnormal discharges in the brain and label a person as epileptic or non-epileptic. But 40% of the patients might have normal EEG. So in that case, we can go in for a further, like a video recording of the EEG, or we can go in for 24 hours EEG recording, or we can go in for video telemetry. The second very important investigation is MRI of the brain to detect various lesions causing epilepsy. And with the present 3 Tesla machines, we are able to pick up more and more abnormalities of the brain. Now, as regards the treatment, various anti-epileptic medications are available. We had the earlier anti-epileptic drugs like phenobarbital and diphenylhydramine, and subsequently at this stage we have newer anti-epileptic drugs. The older anti-epileptic drugs as well as the newer epileptic drugs, they are equally effective. The older anti-epileptic drugs, they are cheaper, but they have little more adverse effects than the present available newer anti-epileptic drugs. But the newer anti-epileptic drugs are costlier. So the older as well as the newer anti-epileptic drugs are equally effective. The newer anti-epileptic drugs have lesser side effects, but the cost of medications become more. Now, treating various types of epilepsy, various medications are used, and various medications are used for special epileptic syndromes. In general, we can say for primary generalized or generalized tonic-clonic epilepsy, valproate or valproic acid or valproate is the drug of choice, while for cases of partial epilepsy, oxcarbazepine is the drug of choice. The recent introduction of anti-epileptic drugs like levetiracetam and lacosamide have added further arm in the treatment of epilepsy, which are also broad-based and can be used for generalized as well as partial epilepsies. Very important thing is, like I told earlier, special epileptic syndromes, they require special medications. Like juvenile myoclonic epilepsy, valproic acid is the drug of choice. Absence seizure, valproic acid is the drug of choice. While in cases of like Lennox-Gastaut and other syndromes, you have to go in for a newer and better anti-epileptic drugs, like, and in cases of especially other syndromes like infantile spasms, we have to use vigabatrin, or in certain cases we have to give ACTH also. Now there are certain do's and don'ts in cases of epilepsy. Very important thing, what we think, what and is the general concept of the patient and the relatives is that as the patient is suffering from epilepsy, they try to put something in their mouth. They try to bring onions or chapels, and they try to bring it near the patient in the concept that the patient will awaken with the dirts and other things, But this is a wrong belief. Once the seizure starts, it's going to complete its cycle. Please don't try to put anything in the mouth. Don't put spoons or metallic things in the mouth, and let the entire episode continue. You just turn the patient on one side and see that the patient doesn't fall. If one seizure occurs, please don't get panicky. Just turn the patient on one side. But if the attacks are recurrent and the patient is going in for status epilepticus, the first and the foremost thing is that stabilize the patient and try to shift the patient to the nearest hospital where hospital facilities like ICU and other things are available. The other common asked questions about epilepsy is there that the drugs that have to be taken for epilepsy, are they supposed to be continued throughout life, or it can be continued for certain periods? Well, in certain types of epilepsies, we can discontinue the medications after a period of 2 years if there are no fits. But in certain epilepsy, like juvenile myoclonic epilepsies or other genetically determined epilepsies, the treatment is lifetime. The other common questions that are asked about epilepsy is that a person with epilepsy, can he get married? Yeah, the patient, male or female, they can get married and they can have a normal life. The other questions asked is about driving. If I am having epilepsy, can I drive? But if you are having recurrent seizures, then it is not advisable to drive. But not according to the Indian driving license laws, but according to the British driving license law, if you are seizure free for more than 1 year, you can drive. The other question is about swimming. Can I swim? If you are having a recurrent seizures or your seizures are not controlled, it is advisable not to swim. But if it is well controlled and you are seizure free for more than 1 year, under supervision, you can swim. Try to avoid or handle heavy machineries which can hamper your life or the life of the in general.